Early diagnosis is key, and after the announcement made here at the City Hall, getting tested for prostate cancer just became easier.
All you need to do is to get your PSA tested is to send them an email, prostate@gha.gi. From that point onwards, they will book an appointment for you in the bloods department, and if there's again anything of concern, they will immediately send you for an MRI.
It's really easy, prostate@gha.gi. Someone emails that, it will come through to myself and the rest of the urology team. We'll review that patient's history, and if necessary we'll organise for them to have a PSA blood test through primary care, and we'll take them forward in terms of other investigations such as scans and, if necessary, biopsies.
A month of prostate awareness was launched with speeches, tea and cakes, and a giant walnut crafted by Peter Ignacio.
It's an awareness campaign that involves all males in Gibraltar, so it's always great to be able to start it off here at City Hall.
Gone are the days now where you had to go to your GP. Your GP would then have to refer you to the specialist. That is no longer the case.
Most men believe that in order to check their prostate, the doctor must stick a finger up their rectum. No, thanks to advances in science, you can now check your prostate with a simple blood test.
It's just a blood test, so the same blood test that many people are having on a regular basis. We will specifically test them for their prostate-specific antigen, which is a protein related to the prostate. And they'll do different thresholds which we regard as being normal, and if it's an abnormally raised result, it doesn't mean they've got cancer, but it is a prompt for us to take them further through some other investigations.
We need to get men tested from the age of 50 years onwards.
Yeah, primarily 50 and over, although actually if you're of a black ethnic descent, and actually your risk is slightly higher than a white Caucasian, so actually for them maybe from 45 we'd recommend having that, or if you've got a strong family history of prostate cancer, again we would actually recommend probably from an earlier age.
Prostate cancer is an issue for men, but women are part of the conversation.
Well, my role is to encourage female, obviously in the female side, to urge their partners to check the PSA, to have regularly checks, which is very, very important for the early detection of the prostate cancer.
It's the first time that they have a female in the committee, and I wasn't quite sure why, but then it was explained to me, and it's so obvious. The women are the support network of their husbands, those that are married, and they also need support to know how to deal with the obstacles that men will encounter during something like a prostate cancer diagnosis.
The PCG deals with the urology problems, that involve obviously kidneys, and if any female feels, feels comfortable to talking with another woman, they can feel free to contact me, and I will give my support.
As a charity, Prostate Cancer Gibraltar pushes for the highest quality of treatment and supportive care for men affected by the disease.
Prostate Cancer Gibraltar stands in support of the Gibraltar Health Authority.
We've been very lucky to be able to work closely with Prostate Cancer Gibraltar, and through them and in partnership with the Consumer Charitable Trust, we had new equipment purchased last year which we've started using to do prostate biopsies, and we can do those in a safe, precise way. We reduce the risk of infections, and it's been well tolerated by patients so far, so we're very lucky to have had that support from those two charitable trusts.
For me, I think it's important for everyone to be health conscious, and have like an MOT once in a while. So yes, very important for us to all be aware of this.
There have been a growing trend now is that more men are being diagnosed with prostate cancer that have shown no symptoms at all.
So if you're a man aged 50 or over, or your partner is, send that email and get your blood test booked today.